好，各位观众，大家好，欢迎收看港湾 TV。今天比平时我们早开2分钟，因为视频信号已经有了。同时呢，也告诉大家，今天的数字会很高，所以呢，我觉得要引起额外的重视。周末又是礼拜一，经过了2天的周末。背景的喇叭已经说了，可能是说2分钟的准备，可能今天的比较重视，又是周末，我要分3个时段。第一、第二呢，数字比较难看。早上的卫生厅长通过邮件已经发给媒体，提到了今天的数字，希望大家引起警觉。所以我们拭目以待，我觉得我们华医做的已经足够好了，真的。所以这个不是单单我们主医的问题了。我看的记录里边，上个礼拜一10月26号，也是3天，317，那时候超过300，已经觉得很厉害。然后293，然后207，然后上星期四是234。我估计今天是会超过500，单天的，看看会不会超过500，这个是大家关心的问题。那么从这个场景来看呢，今天是回到了温哥华，这个背景呢是在 Canada Place， 背景是北温。那么现在呢，还是在背景的是 BC 省的一个联络官，在跟这个技术人员和媒体的这个在讨论这个电话的技术问题 ，call in， 记者要 call in， 大家都可以 call in。
So, you're not going to do it.
What's that?
I still have the dial tone.
Yeah, I know. I'm trying to figure it out. Okay.
Okay. So,
Okay.
Are you hearing anything?
No, I'm not hearing anything.
Yeah, turn it off, turn it on. You can hear dial tone.
Okay.
2分钟应该到了。
Okay, now call.
Okay, calling. No one's done.
Can you get it in? Okay.
It says number call cannot be completed.
And you dial 9?
Yep.
And then if you
Can I try it
just-
again? Okay, dialing 9.
No, that's cool. If that's not
Okay.
working, then you
No,
dial
no,
straight
I'm
out.
just.
Yeah, I don't think you need to
所
dial
以
9.
请大家再稍微等候一下啊，这个卫生官员还没出来。上星期四，因为审选已经尘埃落定，所以卫生厅长又回到了新闻简报室，一起与我们的首席医官 Henry Borry 一起给大家做新闻简报。
Okay, we try pressing 8. Mike said Mike tried pressing 8.
It won't be days.
大家如果已经习惯的收看，我们 BC 省新冠疫情的新闻简报的话，应该时间长了，应该看得出来。
Okay, I got.
首席医官他毕竟还是偏技术、偏知识、偏学术，所以他说的话更加亲民、更加
Okay. Hi.
平缓、通俗易懂。而卫生厅长毕竟是一个政客，所以说出来的话，按照我们中国人的语境来讲，就是一套一套的。
Okay, so is it doing a test? Test.
Okay, speaking to us. Go.
I can hear you in my headset. We're not hearing you in the room.
You have to use a microphone.
You're okay on the mic? Yeah, can someone talk to the podium, please?
1, 2, 3.
Doing a test here, folks. Testing, testing,
大家看
testing.
到了吗？现在都
Giving
戴
you
口
some
罩了
audio
啊！
on the
这个
microphone. Wanting to know
美
if you
国
can hear me
这
okay.
么一个
Let me know. Just
极
giving
静
you
的
some
地
more
方，
audio.
都比
We will be
BC
starting
省
in a
早
couple
带。
of minutes.
5
Thanks
月份
everyone
的时
for
候，
your
我们
patience.
在万维 TV 做白宫的疫情简讯的时候，川普本人不戴，但是他以及他们那个白宫新闻简室要求全部戴口罩了。
We can hear
而
you, I think.
且那个其他的团队的人，在不做新闻简报的时候都戴口罩。当然，川普也象征性的戴了戴，然后说话的时候就肯定摘下来了。所以 BC 省现在才开始。当然，这个 Bonnie Henry 的理论就是说，戴口罩怕别人，很多人特别是小孩有一种误解，觉得口罩戴了万无一失。好像就是保险了，那么所以他始终就坚持说，戴口罩是最后一层防护，是一层额外的防护，到现在还是这个理论，就是额外的防护。那么所有的防护的措施都要一起配套，比如说洗手啊，比如说咳嗽在口罩啊，在嘴巴，然后那个保持社交距离啊，然后才是戴口罩。这个所以，那么在室内的时候，现在提倡戴口罩，尽量戴口罩，因为你不能保证随时随地人和人之间的安全距离足够保证。
We're not using PC at all.
Just leave everything the way you have it. I don't know.
Why did we answer our phones today?
已经3:05了，还没来。做了几个月，我也发觉一个规律，只要是我们卫生厅厅长参与的，一般都会迟到或者是晚一点，很少有时间是准点的。那么 Bonnie Henry 如果一个人的话呢，基本上都是准点的。当然，可能我们对他们也要求比较苛刻了啊。现在3:05，可能人家当官的事情比较多一点。所以今天呢是周一，还会按照3个时间段给大家报数字。那么从上星期开始，中国外交部要求所有回去的人，境外回中国的人，一定要这个双阴，所谓的双阴，一个是咽拭子，还有一个是血清的这个阴性，血清抗体，说明你有抗体也行。所以这个造成了大家一下子紧张，比较恐慌。当然，不回去的人还是多数了。我相信选择回去的人，除了一大部分留学生以外，还有一些必须要回去的，比如说父母啊，本来来探亲的，实在是待不下了，或者是要急着赶回去看病啦，或者是像我们这种做子女的，在国内有紧急情况了，必须要回去了。那么非必要呢，也就不要回去了。那么现在中领馆指定是2家医疗的 clinic 可以做这个中国认可的这个检疫，就是检查。那么2家大家上中国的领事馆可以去看。中国领事馆呢有中文和英文。好，卫生厅长已经出现，看来心情比较沉重。卫生官没来。
Hi, my name is Adrian Dix. I'm BC's Minister of Health. To my left is Dr. Rika Gustafson, who's the Vice President of Public Health and Wellness for the Provincial Health Services Authority. She's the Deputy Provincial Health Officer, and she runs the BCCDC. And this is our COVID-19 briefing for British Columbia for Monday, November the 2nd, 2020. We're honored to be here on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. Tomorrow, Tuesday, we'll be providing a written briefing, Dr. Gustafson and I, on the COVID-19 situation. situation in British Columbia. On Wednesday, Dr. Henry will be returning and providing with me a written briefing
礼拜三，
on
亨
that
利医生
day
也
at
回来，
around
但是
3
也
o'clock.
是给大
And
家
on
书
Thursday,
面的
Dr. Henry
3
will
点钟左
return.
右。
Dr. Henry, because I know people are always interested, is taking a couple of well-deserved days off, although, like all of us, she'll be, I'm sure,
那么
spending
他
a
也是说
lot
到
of
了
time
亨利医
thinking
生
about
很辛苦
how to，
他
deal
也
with
是
the
值得
COVID-19
好好休息，在疫情以来一
And
直
so,
是辛勤
with
工
that,
作，
it's
所
my
以
honor
这个
to
这2天是
introduce
亨利医
Dr.
生
Rika
是
Gustafson.
在做休假休养礼拜三回来。好，
Good afternoon, everybody.
大家下午好。
I'm Rika Gustafson,
他是
Deputy
Rick
Provincial Health Officer, and it is my pleasure to provide you an update today. Today we are updating on 3 reporting periods, being Monday. From Friday to Saturday, we had 352 new diagnoses of
352
COVID-19. From Saturday to Sunday, there were 389 new cases.
389
And from
个
Sunday to Monday, 379 new cases. For a
370
total of
379个
1,120 new cases
一
over the
1120
weekend, over
个
that 3-day
3天
period.
3天是
That brings
1120
our
个。
total in British Columbia to 15,501 cases of COVID-19.
15501个。
New health authority cases, to give you a sense of where the majority of transmission are occurring,
那么他也是
there
说
were
到了这个
234 new diagnoses in Vancouver Coastal Health, 830 in Fraser Health, 9 in Vancouver Island,
他现在不是报
36 in
总数
Interior
了，他
Health,
现在是报的
and
是
10
新
in
增
Northern Health.
各个卫生局
Since
下
the
的新
beginning
增
of the pandemic, there have been 90 new cases of COVID-19 in individuals from outside of Canada. At the moment, we have 2,945 active cases, of whom 90 are currently in hospital. 19 are in critical care or intensive care
哦
units.
这个还可以。
Since the last reporting period, we've had 6 new individuals who have died from COVID-19 for a total of 269 deaths.
6个死亡
5
厉
of these
害。
individuals were in Vancouver Coastal Health and 1 in Fraser. And we would like to extend our condolences to their families.
90个住院里边
At
19
the
个在重
moment,
症
we
监
have
护
6,448 British Columbians
这个还
under active
有点
public
令
health
人
monitoring.
稍微喘口气。
There are 3 new healthcare outbreaks
3个
reported in this
新的
period.
卫生诊疗所
The
或者
Good
是长期护
Samaritan
理院
Delta View Care Center,
已
the
爆发
Hamilton Village
宣布
Care
爆发
Center, and the Rotary Manor in Dawson Creek. One outbreak, the Bailey House outbreak, was declared
有
over.
一个被
At
宣
this
布
time, we
官
have
方
28
解除
active
爆发
outbreaks in the healthcare
现在有
system,
28个
26
长
in
期
long-term
护理
care
院里边
facilities and assisted
26
living,
个长期护
and
理
2
院
in
2个
acute
急诊
care.
性诊疗所爆
There
发
have been no new community outbreaks.
没有
and the
新增社
outbreak
区爆
at
发
JL Beef is now over. A reminder to everybody
那
to
么
please continue to regularly check health authority
那么也
websites
时
for
刻提醒大
community
家去
exposures,
经
which
常
are
去
updated
上我
regularly.
们的
And if you've
BCCDC 网
attended
站
one of
看
those
我们的
locations, to
最
please
新
follow
的
the
这个
instructions.
宣布哪些有学校
So these numbers
exposure 哪些有
are
社区的
concerning for all of
outbreak
us. But we have learned a great deal about
他说我们已经
COVID-19
通过
since the
从
beginning of the
从
pandemic.
疫情一开
We
始
have
到现在
learned
我们
that
学了
living
很
with the
多
vi-
我们
what
吸取
living
很
with
多
the
教训
virus looks like
我
and
们
what
如
we
何
need to
面
do to
对
keep
如何
ourselves,
病毒
those
共
around
舞
us, and our
病毒一起
communities
生活
monitoring the
如何
epidemic
保护我们安
closely,
全
testing to identify new cases, contact
所以
tracing
我
to
们的工
contain
作是
further
公共工
transmission,
学的人员也
and
是
using
在
our layers of
学会了
protection
如何
are
迅速的找
cornerstones
到
of our
然后
response.
扑灭
These are the
溯
tools
源
that we continue to use
也
as we
是额外的
navigate
增
this
加一层
pandemic
如
in the
何的
coming
安全保
months.
护
Our goal is to continue to
我们的目
minimize
的
severe
是
illness
一定
and
要
death,
使大家
balanced with
持续
keeping
的
it as much as
保持警
possible
惕
open
那
and active in
个
our
减少
communities.
病情的重症的爆发重症
As the
症
weather
病
gets
的这
cooler,
个
and
发
I
展
think everyone's noticed that the weather has
那么
gotten
天气已
cooler,
经越
and
来越
our
冷了
activities move
希望大家
inside.
我
We
们
are
很
going
多
to see
行动行为都
fluctuations
活动都
and
往室内
surges
走
in
了
some
所以我们
communities.
室内的
We
话
know
更
this
容
from
易
British
传播
Columbia. We know this from around the world.
我们也知
The
道不
recent
仅仅是
increased
我们的
cases in
BC
the lower
省全
mainland
世界
and
都是这样
particularly in Fraser Health
那
are
么
an
菲沙
example
卫
of
生
this.
局现在
And when
已
we
经
do
特别很严重
experience these surges,
啊
we need to respond with increased
我们一
effort
定
and
要
stepped up
积
focus
极应对
using
这
all
个
of the
疫
public
情
health measures we have available to
啊
us.
所以我们
We
的这
know
个
that
公卫
being
系统人
inside
员也
and
是
in
在积
close
极协
contact
助
with
大家
others increases our risk, and that has been a significant cause of new cases in recent weeks.
那么在过去几个礼拜以来，大家可以看到了新增疫情会快速增加这个也是看到了大家一定要提醒大家就要聚集人少一点，这个对大家来讲真的是很困难，但是这个也是必须的。我们绝大多数省民都是很好的注意了，完全遵守了我们的行为规范大家也看到了很多与家人一起共享这个万圣节欢度过，大家持续的关注注意这个避免这个传播，我们也已经学到了很多如何的安全的这个避免这个病毒。那么很多呢卫生措施还是落实到位，行之有效。那么很多的时候我们必须不要，一个是勤洗手，第二个戴口罩戴口罩了，然后呢我们还要保持这个社交距离在学校里边大家一定要遵守我们的行为规范遵守行为的卫生秩序那么如果你有生病或者不舒服，不要来，不要上班，不要去，那么这样的话呢保持我们社区的传播低一点。那么如果是觉得不舒服，我觉得要这个安排尽早的安排，有旅游的话尽早安排去检测事先预约。请大家记住，我们的公卫系统工作人员是帮你们的，不是来判断你们的这个不要怕，你就找我们，不要有顾虑，就是这个意思那么全球环境，全球那个这个全球病毒呢已经11个月了我们希望大家继续的保持，继续的努力，继续的保持警惕使得减缓病毒的传播，能够这个不让病毒的轻易的传播。希望大家都能够安全的度过整个冬天那么请现在就是卫生厅长来这个再跟大家总结一下说一些官话。那么他今天礼拜一应该是给大家汇报我们整个省的 PPE 的准备情况那么也是说到了6个死亡这个周末6个死亡包括是5个长期护理院5个在长期护理都是菲萨卫生局下的这个对菲萨卫生局来讲，对失去亲人家庭讲都是很困难的时期这个长期护理院这次太严重了。那么他也是说一些这个悲伤的话这个我也不重复了。那么有一个就是90个住院比上周多了4个，但是重症监护一下子下降5个变成19个了，这个也是一个好现象，因为新冠疫情最怕的就是击垮医疗资源。那么如果医疗资源没有被击垮的情况下，那说实话，那人家很多人说你说的轻松了，就好像就是一个其实就是一个感冒了我们也希望这个病毒朝这方面走。那么同时提醒大家能打这个流感疫苗就去打流感疫苗，不要有顾虑今年的和去年一样，那么 NDP 是我们的执政党，真的是免费的这个是从去年开始的他没有说免费，但是你到了药房去打基本上都是免费的，这个是前所未有的，之前都要付钱的，你哪怕有 MSP 也要付25到30块钱。
And that is an enormous achievement for our healthcare system. With that in context, 53 people in hospital are currently in hospital in the Fraser Health Authority and 37 in the Vancouver Coastal Health Authority.
那么37个是在延安卫生局，57个是在53个是在这个菲沙卫生局，所以加起来是90个。那么其他的卫生局下面就没有住院的这个也是好消息，一共90个住院菲沙卫生局是53个延安卫生局37个。那么他说上周四他们是在卫生局给大家做的简报。
945 active COVID-19 cases, 6,448 people under public health surveillance.
那么现在有6000多个6048个是在我们公卫系统的监视下，在这个自我隔离那么现在这个就是我们的记录在案的是2945个，就是活跃案例 active case。
hired in
那么
Thursday's
他也是说
report
到了，就
and the
是有
extraordinary
多少
work
公
that
卫
people
系
are
统
doing
工作人员
throughout
雇
the
佣
healthcare
的
system, but obviously
在
not
这个
just the healthcare system,
在
but
付
people
出
who
额外的
work
辛苦努力
in
在做
service
这些
industries and grocery
跟踪调
stores
查
are
接触工作
extraordinary teachers in
这个也
British Columbia and
是
others who
他
are
们
doing,
是
I think, an
已经
extraordinary job on
还
all our
包括
behalf.
了还有一
And
些
all I can
雇佣
express
了
is
很
my
多的老
gratitude
师
to all
因
of
为
them.
他也是
Part
很
of a
心怀感
reflection of
激
this, and
这个
as
是
you
都
know,
是
on
在
Monday,
为社会做
give an
贡献
update on our
这也是我们
PPE
真的是
situation
赢
in
得
British
社会
Columbia.
的
You will
整个尊重
note
和
that as of
赞
last
赏
week's report, Monday, October
那么今天他
22nd,
现在要汇报这个
BC, the following
PPE
PPE had
的
arrived
准
in
备
BC
那么 PPE
since
是什么意
March.
思呢？就是
Just
个
over
人防护设备
7,300,095
Personal
or equivalent
protective
respirators, over
equipment 所以叫
75
PPE 那么
million
包括
surgical or procedure
他也是
masks,
说到了这
almost
个
2.8
医用口
million
罩
pieces of eye
一次性
protection,
的手套
including goggles and face
还有
shields,
防护目镜
almost
，goggle 就是护目
173
镜
million
还有就
pairs
是
of
防护
gloves,
服
and almost
还有
12
什么呢？
million
还有就是这个
gowns.
消毒
I
剂、
wanted
消
to
毒液
note。that over the past week, and this is an extraordinary achievement for the people
大家
working in
说
this area,
上个礼拜已
we
经完成了额外的
a
很多的
further
工作完成了很多额外的这个成
N95 or
就，
equivalent respirators arrived in BC.
包括 N95 口
And this
罩。
number is astonishing: 49,256,652
那么他说这
surgical
个
or
是令人
procedure
难以置
masks,
信的，整个到现在完成
29,000 pieces of
了
eye
采购
protection,
了4900万个口罩啊，等等等等啊，
19,775 pairs
保
of
护目镜啊
gloves,
等等
and
手套啊，
772,730
这些都是一些数
gowns.
字
This is an
无关紧
extraordinary
要啊。这
achievement
这
for
个作
people
为
who
政
work
客，
at
他只会
Provincial Health
这个
Services
要给大
Authority
家
and
说一
Ministry
下，
of
说
Health
明
and
他
the
这
health
是他的工
authorities,
作，
and
也
I'm
是他
very
的
appreciative of
achievement。
their work
那么
as
他
it
也说
continues
感
to
谢
ensure that our
所
healthcare
有的
workers
参与这个
have
采购
the
工作
PPE
人
they
员
need to
那
do
么使
their
得能
courageous
够
work
很多
on
需
behalf
要
of all of us. I
PPE
want
的
to
前线
note
工作人员能够得
that
到
works at
的
BC.
装
It's
备
not just the health
和
system
保
has
护
been。doing a significant work. I want to note the work of prevention officers there. That over 17,600 workplace inspections to review employers' COVID-19 safety plans and assess the effectiveness of protocols have been performed during the pandemic by
他说，现在有全省有17600个工作人员在协同各个雇主工作场所落实检查卫生措施状况这个也是我感谢的在这么短的时间里边，能够使得各个行业重启做出了应有的贡献因为他们这个付出的额外的努力，因为只有他们同意你这个商业才能开是这个意思。
Across 3 major initiatives, and I want to note the following. That on the first part of that initiative, because this had been directed earlier on June 30th, we issued guidance to support family and social visitation in long-term care and assisted living.
从6月30号以后，长期护理院可以有探访，稍微松动了，之前是没有了那么现在是那么已经有目前为止已经超过了200多万的钱拨款去支持这个大家对这个长期护理院的探访的。那么现在看来，这个长期护理院的探访也是很繁忙。
Support initiative, support worker FTE or Health Career Access Program, initiative. I just want to note that we've received already 8,188 expressions of interest from all over British Columbia in response to this initiative, and that initiative is underway and proceeding, and we'll have more to report in coming weeks. But what it says is that in terms of long-term care, the effort and the initiative to put in place and to ensure that long-term care facilities are safe and that we can in fact allow more visitations in future
那么他也是说到了，也感谢这个长期护理院为大家着想。那么只要落实安全措施到位慢慢的还会更多的开放探亲探访。那么现在是这个是很困难的时候，也感谢大家做出的辛苦努力也是做出了很多的牺牲。
In closing, I want to say that obviously,
那么在作为总结那么现在对每一个人来讲都不是一个轻松的时候包括医生护士护理人员对每一个人来讲都不是一个很舒服的时候，所以这个每个人的大家都有一个相互能够有一个相互支持、相互帮助共同度过这个困难的时候我们要有一个期盼，就是大家团结在一起。
a pandemic. Those connections
那么
that we
这
count
个
on
pandemic
need
就
to
是
come
全球
together
流行病
are the things that COVID-19 seeks to spread. We know what we need to do to stop the spread.
他说：“我们大家很清楚都要尽早的结束这个疫情，阻止这个病毒传播。但是怎么做这个，所以大家看一看全球的形势没有一片净土。所以我们现在又是在一个新的阶段。我们必须马上行动起来，积极应对这个新冠疫情。”那么现在呢，马上天气越来越冷了，我们慢慢的就开始就全部到室内了。很多人这个慢慢要生病了，又会很多人失去生命这个因为流感来了所以我们希望大家能够身体强壮积极的去面对这个病毒包括亨利医生，包括 Rick 医生，包括我也是积极的期盼大家我们也是支援大家能够家庭能够安全，能够安度这个冬季。我相信我们能够做的我们就算我们都能做到的，哪怕部分我做到，我们也好。每个人做好自己的事情，他就part of it 对不对每一个人都做自己的分内事，那么就是怀着热情去这个遵照我们的卫生指引那么也是用怀着热情，怀着自己的这个对这个心存感激，对大家有一个这个怎么慷慨这个态度积极帮助大家，相互支援，相互支持那么这样的话呢，就是能够阻止病毒的传播。当然，我上次就说过，我们的卫生官员就是 Dr. Bonnie Henry， 他是3个著名的 Be calm, be kind, be calm, and be safe 就是希望，然后他最多就是 continue 继续安心，大家相互容让 ，kind 就客气be safe 就是安全。那么这个卫生厅长呢，他说的更多一点政客嘛如果他的政客的话，你也能说，我也能说，那我们都是政客了。所以，那么现在他是用法语在给大家重复一下刚才的一些话。那么现在听出来呢是这样，就是90个住院里边呢，53个在飞沙卫生局，37个在沿岸卫生局。那么不一定表示那个内陆的就没有人住院或者是怎么样，也有可能我的理解就是他们有这个情况，可能也转过来了这个是我的理解，没有根据。比如说岛上卫生局内陆卫生局可能就是转到这儿来，也可能因为集中或者是隔离的要求或者就是不是的，我的理解错，我但愿理解错因为从这个人口比例来讲，沿岸卫生局应该是比飞沙卫生局人口少很多，但是这个住院人数好像还不是。
Thank you, Minister. And a reminder to the media to please press *1 to line up for questions. We will be taking one question and one follow-up this afternoon. And also, please do not mute your phones. You will not be heard until I call your name. We begin today with Jennifer Stoltman, Vancouver Sun. Jennifer, go ahead, please.
卫生官员都是女的。
I was hoping you could talk about COVID-19 exposure and transmission on public transit.
这位女记者问的是公共交通的传播病毒的问题。
Thank you very much for your question, and it's actually a common question, and there are very good safety protocols on BC Transit.
他说我们 BC 省的公交系统有一个很好的卫生措施。
For COVID-19, we're looking at where people have been in the last 14 days.
那么大家可以看看14天的过去的14天。
Determine whether transmission has occurred on transit may not be possible, but we have some very good indication that it's not a major source of transmission.
过去的14天里边没有很多人是在公共交通里边传染到的这个很清楚，上次就说过了，都是在室内这个家庭聚会得到的这个他说这个也是一个很好的
And therefore, if we thought that places like transit and other areas where we have casual contacts with people or were a major source of transmission, then the proportion of people who didn't know where they were infected would be much higher. I would also like to re-emphasize that we've also implemented some important safety protocols in public spaces, such as
在公共地方都是比如说公交系统，我们公卫系统都有一层额外的卫生措施和卫生指导那么现在看来，很多人他在哪里得到的病毒还是有很清晰的路径可以查到特别是这个不明原因的几乎还不多，比例不多，所以这个公卫系统比如说在公交里边传到的感染的很少，人和人之间如果偶尔接触不会传到。
A bus on which you are for several hours, there may be a public notification in a situation like that.
如果我们知道有一个人他是在公共交通里边是暴露的话，有几个小时我们马上都会给在 BCCDC 网的公布。
Through casual contact is
那么
not
他说
occurring
casual contact 就是偶尔接触的不是 close contact
where people have safety
close 的这
protocols
种
in
紧密
place.
接触的。
And although there may be
我们都有
a
一些卫生
notification
指
that
引和卫
initially we
生
had
措施。
notifications, for example, for other forms of transit, such as airlines.
那么
But we are finding
那么
that
他
those
说
are
不单
not
单比如
major
说是
sources
公
of
共汽车
transmission.
还
So
有
we're
很多的
focusing
飞
our
机现在
contact
看
tracing
来
and our public
这
notifications
个不多，我们的公卫系
on
统的有一套
situations
这
and
个
in
跟
places
踪
where
接触
transmission
的
actually
调
is
查
occurring.
有一个办法
Thank you. The next
都能够
question
知
comes
道
from Richard
基本上
Zisman,
能够
Global
判断
News.
出这个传播的路径、
I'd
传播
like
的
to
地
ask
点。
about whether we will ever get information around a regional breakdown in terms of where these cases are being identified in a larger Fraser Health area, and whether, connected to the weekend, whether there were any measures being put in place to address areas like the Granville Strip before Halloween, and how does this factor into an event like New Year's?
Okay, so I can answer. I actually don't
那
have
么这位
specific
记者是
information
想
about
问的
the
就是
measures
这
that
么
have
多
been
比
put
如
in
说
place on
飞
the
沙卫生
Granville
局这么
district.
多
I
的
don't know
案
if
例
Minister Dix
那么
does.
能
I
不能
don't
再
have that
详细的
information.
讲一下哪些
The-
地方哪些
Can you repeat
地
your
方
first
获得的
question?
哪些这个时间获得的
Yeah, about
他说不愿意说
regionality. There are a
Yes.
lot of people in Surrey I'm hearing from.
那么
saying,
他
why
说
wouldn't you
树立
release
很多的地
information
方
by
有些
neighborhood,
宗教的原因
or
我
by
听说了
smaller
很
regional
多的
districts
这个
so
社
people
区
can understand where
这个
this
或者
boom
是
and
小邻居的
this
社
virus is
区
happening.
这
We're
个很
actually
多的
working
病毒
hard
在
to
传播
provide more and more granular information. I think your question is a really good one. We know, as I mentioned before,
但是我们过去也说到过
COVID-19 is
这个新
transmitted
冠疫情这
in
个传播
known chains of transmission and outbreaks. And the
我
more
们的这个
information you
病
have
毒的
about
传
your
播链我们
community,
是很清楚，在社区里面传播也很清楚。
you're more empowered you are to take
这
precautions
位
as
他
needed.
一直
So
在
we
挑
actually are
词在
working
回
to
答
provide that information in as visually appealing and as easily understood manner as possible. So I think it's a good question and it's
他
a
说
good
你提的
request
问
and
题
we're
比较
working to
好，我
provide
们也
that
会希望能
in
够
as
用这
granular
个
a
大
way
家
as
通俗
possible.
易懂的方式把这些信息给大家。那么卫生厅长又来做政客，开始他知道如何回答。
Richard, we provided more and more information. We provided, month to month, more information by local health area and obviously regular information by health service delivery area. The one thing I would say, though, to people across British Columbia is that this is a worldwide pandemic. There are approximately, I believe, in France today, which has an organized public health system, 60 cases.
他又说到法
7-day
国，
rolling
他说
average
今
of
天一
60
天就
cases
是
a day
66万
per
多。
100,000, which
这
was,
个有什么关系呢
I think 9 to 10 times what it is in British Columbia.
他
Just to
说
put
也
that
是
in
比我们多了
context.
10倍多，又怎么样呢
What that tells
人
us,
家是问的是
if you look
你
at
能不能
the
给
rest
我
of
们详
Canada,
细
you
一
look
些
at what
具体
happened
的
in Winnipeg
社
2
区
months ago
或者
and what's
是
happening now
这个案
is
例，
that
比如说
COVID-19
什么
is
活
a
动得
worldwide
到的
pandemic. It can affect us
那么他
everywhere.
是
It's
说到
why
全
we
球
need
了所以这个就是
people
政
to
客
take action everywhere
刚
in
才那
British
位女医
Columbia
生
because
她
the
就不知道怎么
situation
去
can
回答
change. This is
那么她也是说到了这个
COVID-19
全
is
球环
something
球
designed
球
to
球流行病是
transmit.
会影响到我们每一个
And
人
so,
这
or
个
at
也
least
是在
so it
传播
appears. And so
所以
we have to be ready and determined everywhere.
我
With
们
respect to
每
the
一个地
Granville
方
Strip,
都要
I
准
mean,
备
I
好
think
就是说不
there
要
are steps
让
we have to
病
take
毒轻
everywhere.
易的
But
传
one of
播
the
很容易
things
的
that
传播
is particularly obviously frustrating for the overwhelming majority of people who are following public health
那么他
guidelines
说
and
绝
public
大部
health
分的
orders
省
to see
民
that
都是遵
because
守
it
我们
was
的
in
卫生
public
规
and
范
because you could
行为规
visually
范
see
走的，按照我们
what
的
was
行为
going
规范
on
走
and
的。
some of the behavior was
那么很多有些行为呢
beyond
不
the
好
public health
没有
orders,
但
simply
是
disgraceful. But I
我
would
们
say
觉得
this,
他们也是可耻
that
的。
one of the order that Dr. Henry brought in
那么
last Monday
上
with
个礼
respect
拜
to
一我
private
们
residences is
会医生
important.
发了另外一
Some
个
of those
新的卫
events
生
which
命
have
令。
seen a lot of transmission and we
我
review,
们
as
就
you
是
know,
因
every
为知
case
道了很多新增的
have
案例
occurred
都是
not with
从
cameras around,
这
not in the way
个
we can
那
visualize,
边这
but
种
in
行为出来的，
indoors,
所以上周一
in
就是
private
室内
gatherings, sometimes
聚会
relatively
不要超
small
过6个
gatherings.
人
And so
这个
what we're
就是
asking
他说
people to
私人的
do,
聚会
especially in the
这
season
个
of
所以
gatherings,
因为现
in
在
the season where
季
it's
节
colder
到
and
了
the season when
那
the
么
days
这
are
个季节
shorter
又是庆
is
祝的
to
季节，又
strictly
是这
limit
个
that.
流
And
行
that's
季节、
why
流行
the
感冒季
maximum
节，
of 6 is
所
in
以
the
他
public
说
health
希望
order,
大家严
and
格
that's
遵守
why
我
our
们
advice
最多
to
不能超
people
6个人
is
的
to
聚会禁
avoid
令。
such gathering and stick within
家
the
里
home,
边聚会6个人啊，
the home
上星期
circumstances
一，亨
to
利医生
your
颁布
to the
的卫
people who
生
live
的
in the
命令
home.
新命令。
This is one way, and we see this from the evidence that public health sees every day.
所以
that
他
we
说
can
我们
stop the
作为公
transmission
卫
of
系统的人，
COVID-19.
每天看到的都是
Do
这
you
些
have a
案
follow-up,
例
Richard?
啊。这才是真正他回答这个刚才记者这个问题，就是绝大部分还是私人聚会引起的。
Why are there still concerns around this as an additional tool, the federal app? And are contact tracers, are people being moved out of the healthcare system right now, those who give immunizations or vaccines, are they being moved out of those positions right now to help contact trace?
So with respect to the contact tracing app, I do
那
want to
么
let you
这
know
位
that
记
we
者问的
reviewed
就是
that
联
app
邦有
very,
一
very
个
carefully, and we
APP 啊，我们
reviewed
叫
it with the
APP，
people
英
who
文叫
do
App。
contact
那么
tracing
就是说
and
这
do
个
a
接
lot
触
of
的这个
contact
App，
tracing
那
and
么
do
为
it
什么
very,
还
very
们不
well.
用啊？
And
他
based
说
on the
现在市
features
面
of
上
that
有很
app,
多还是
mostly because of
很好的
the
App，我们 BC
the
省
type of information that's provided
因
individuals.
为没有很多的数
It
据去
wasn't
输入，
felt that
所
at
以
this
还没有
point in British
没有
Columbia
更
it
多
would
的私人信
have
息
additional
啊，
benefit,
所
would
以
be additional
所
value
以
to
我
the
们 BC
existing
省没
contact
有
tracing.
额外的
The other
通
thing that
过
I'd
这
like to say
个
about apps
这
and
些
digital
APP
tools
获
is
得
that we
额
are
外的利
learning
益，
every
所以
single
没有
day.
去推荐
And
给大家。
while we may not have been entirely clear on what digital tools would be helpful for us in BC, we are, as the epidemic evolves, as our skills and our workforce in responding to an epidemic of this size are evolving, we are actually identifying the digital tools that will be helpful for us and that are helpful for us, and those are being developed and rolled out
那么
as
他
we
说我们
speak.
BC 省现在也是在做一个自己
And I'm
BC 省
going to
自
hand it
己
over.
的这个一个好的我认为还是比较符合我们 BC 省秩序的这个 APP。马上有作为一个工具让人家觉得这个是给大家使用的。那么他说我也知道这个2位医生他们工作了很辛苦也是跟联邦的官员一起合作那个我们的目标是保证每一个如使用的这个 APP 一定要是对我们的这个接触联系有帮助的。我们从来没有停止过在这方面的工作在和联邦一起这个找到问题的症结把这些问题都解决掉然后那么我们也是希望大家能够遵照我们的这个建议根据卫生官的建议遵守这个公共卫生的指引所以请大家还是先遵守遵守这个卫生官的忠告听从他们的建议这个比任何的 APP 都很好都好多了
Many of them have other jobs, and so one of the reasons we're building up public health, why we announced 500 more people to do this work, why we've hired 523, why
那么现在呢我们是额外雇佣了523个人在做这些跟踪接触工作
not just contact tracing, but all the work that it does. And this is a key part of what we've been doing. It's why we started in advance of this fall period, which I think everyone understood was going to be difficult given respiratory illness season. And it's why we started doing that work in the summer. And so what we're doing is building up the overall strength of public health, and that means doing all of the work of public health. But this work has been particularly important in recent weeks when you have more than 6,000 people who are being monitored by public health. Adding hundreds of highly qualified people to support our efforts is a good idea, and I'm very proud of the work they're doing and having had the opportunity to see some of them in action on Thursday, for example. I can tell you they are extraordinarily committed.
Thank you. The next question comes from Shannon Patterson, CTV. Shannon, go ahead, please.
Oh, hi there. With numbers this high, and now we see other Canadian cities and regions around the world bringing in tougher restrictions for indoor dining, non-essential businesses, what will it take to bring in tougher restrictions here if this number over a weekend isn't concerning enough to look at cracking down? What number would
So I would not say that there's a specific number. There's a number of things that we are monitoring all the time to understand the impact of the pandemic on our community. And the things that we are monitoring are the number of new diagnoses, how rapidly they are changing, whether or not we can identify where people have received where people are able to identify where they were infected, our ability to follow up cases in a timely way, our ability to continue to provide testing, and as well as keeping in mind what the ultimate goals of pandemic control are, severe illness and minimizing deaths, is monitoring those indicators as well and looking at how we are managing this pandemic. This pandemic is something that we are managing, and the tools in our toolbox are contact tracing, testing, contact tracing, as well as additional and specific interactions or interventions that we need to do in response to surges. There's also public health measures that we are all doing throughout British Columbia all the time, and these are all tools in our toolbox. So I would say that there isn't a single number. There is a team of public health professionals that are monitoring the epidemic, its impact on our population, its impact on our healthcare system, and are also monitoring our ability to control it and respond. So at this moment, we have a concerning number of new infections. At the moment, we're also, the hospitalizations are stable, the number of people in ICU remains stable, and these numbers and these indicators are being monitored all the time.
Do you have a follow-up, Shannon?
Yeah, for Minister Dix, one Metro Vancouver Police Department told me today they've issued 4
听不清楚啊，大家觉得吧？就是这个记者问的啊，因为他不是在省政府的这个专用的。
Are you worried that feds aren't doing enough to monitor and enforce people arriving from other countries to quarantine?
Well, I think it's a good opportunity to remind people of their obligation, their absolute obligation to self-isolate when they return to Canada.
那么也是说到了从境外回到 BC 省，这个也是一个好的机会。这么多的数字提醒大家，你要自我隔离，这个是你必须做的义务，这是你的义务，你是必须自我隔离24天。希望大家能够认真对待这个时刻记住。
COVID-19 as a pandemic
因为新冠病毒是全球流行病
has much more severe circumstances, and indeed in many parts of Canada
在加拿大其他地方。
都很严重。On this weekend, so that's absolutely necessary. It's something that we review regularly with the federal government.
所以我们也是时常和联邦政府一起检视我们做过的措施做法。
Expectation that people who return to Canada
所以这个也提醒大家如果你回来了，你要对你的社区、对你的家庭表现出你自己的责任和义务，来自我隔离希望大家能够严格遵守执行这个14天的周期。
The story from the police officers that you've heard from, but we have to continue to monitor this question. The one thing
所
I
以我
would
们的公卫系统工作
repeat
人员
is
也会积极的
that we have
去观
and
测
you have
监视
seen
他们监
a
测他们
significant
啊
public
这个
health
监视
order
不大好
last
啊
Monday
monitor
from
就
Dr.
是
Henry
监
and from our
管
team
吧
around gatherings in people's
那么
homes.
还有呢就
So
是很多的
we
适龄
we
家庭
also
聚
see
会
and the important role that WorkSafe is going to have to play and continue
那
to
么我
play
们的执法
in
人员也
ensuring
会
that we
积极
monitor
的执
COVID-19 in
法
workplaces because we've seen significant outbreaks
因
in
为我们已经
workplaces.
看到了很
And
多
we have
的
to
地方的
continue
爆发
to
都是由于家
to
庭
do
适龄
this
聚会
work. But those are public health orders that
那
limit
还有
people
呢
to
就是
6
工作
people
场所
outside
也要
those
希
living
望
in
大
the
家
home.
能够执勤
And
遵守我们的
there's
行为
also
规范
public health advice in Fraser that
那
Fraser
么
Health
希望
that
大
might
家
be
严
less
格
than
遵
that.
守
So
6个人的
when we
聚会禁
focus on
令最
issues,
多6个人
it's because those issues are the sources of transmission.
因为我
And
们已
when
经
public
看到
health
了这
gives
个
an
新增
order,
的很多案
it's
例都是
based
这
on
么
the
得
evidence. It's
来的
based on a
都是
detailed analysis of this evidence by some of the most qualified people in the world. And
那么
and
我们
so
所有
all of
所有
this
的
is
这
done
些措施都是
methodically
根据
and
我们
with an
世界
effort
上最
to
合格的工
reduce
作
the
人
risk
员
of the
跟踪
population,
调
but
查
and
得
also
出
to
的这
limit
些
transmission. So
这
those are
个
the
经
steps
验
we're
教
taking.
训
So
所以也
yes,
是我
international
们
travel
根
is
据
one of those
这些
aspects, and it's an important one.
经验教
But
训
so
得出
I
的
want
结
to
论才
repeat
做出的
by
行
the
为
orders put
措
in
施
place by Dr.
这
Henry
个建议
last
行
Monday.
为建议
Thank you. The next question comes from
所
Xiao
以我现
Zhu,
在
Globe and
还
Mail.
是
Go
要
ahead, please.
重复上周一的行为卫生命令，希望大家私人聚会不要超过6个人。
About the COVID app. So, what is it specifically about the app that CDC is concerning, and why would the app make contact tracing more difficult? Thank you.
I'm so sorry. I'm going to ask you to repeat your question. I had
是
trouble
听不清
hearing.
楚。
Okay, yeah. Hope to ask, what is it specifically about the app that BC finds concerning, and why would the app make contact tracing more difficult? Thank you.
还是问到这个 APP 的问题
So
还是跟踪接触
the
的问
app
题，你
that
们
in its
顾
current
虑是
state
什么？
can inform an individual that they were exposed to COVID-19,
那么主要
but
是
it
个人
isn't
的
able to
信息
notify and tell them when,
那么
how long, what they need to do, how
主要是
intense that contact was, how close
主要
that
是关
contact
键
was,
是如
when
何
it
定义
occurred, and
他
what they
们
need to do
跟谁
about
接
it.
触是
So
如
one of
何
our
亲密
challenges is
这个
that
接触的
in
时
order
间
to
长
act
短
in a meaningful
行为
way
方
on
式是什
an
么？
exposure about information, you need to have some details about it, so
所
you
以
know
我们
whether
一
or
定
not
要
that's
知
an
道他
actual
们这个就
exposure,
算是 exposure 就是暴露是
whether
什么
you
情
need
况
to
下的暴露
seek, you need to self-isolate, but you
我
need
们
whether there's a significant risk to you of COVID-19 above and beyond the background risk. And I think that's the other thing to keep in mind is that we all know that COVID-19 is transmitted and circulating in our communities.
所以他
So
说
there's
根
certain
据这个
basic
环境
things
的
that we
变
all
化
need
以
to
外，
do
我
all
们
the
一定要
time.
时
We
刻
monitor
记
our
住
health.
病毒
We
在传
isolate
播，
if
病
we
毒在我
become
们周
sick.
围
If we have any
那
symptoms,
么
we
如
stay
果
away
你
from
自己
people who are
这个
vulnerable.
病
We
如
seek
果
testing
这
as
个自己
necessary.
不舒服
We
或生
wash
病的
our
话，
hands.
请
We
你
wear masks.
远
All
离
of
人
these
群
things
这个
are
所有
basic
的必
things
须
that
遵
we
守的，
all
这个
need
是
to
我们的
do.
基
So
本的
being told
那
that you
么
were
人
near
和人之间
someone
保
with
持距离，戴口
COVID-19
罩，
doesn't
还有
change
呢，一
any
定要
of
记
that.
住，我们
It's
还有
what
一
you
个
would
易
be
弱群
doing
体，易受
as
这
a
个
background
受弱
activity
的
all
那
the
个
time.
羸弱的
What
群
we're
体，易受
working
感染，
toward
易受攻击
in。British Columbia and with our federal partners is to improve these tools
那
to
么我
allow
们现
us to
在
provide
说包括的
information
这
to
些
people
app、
that is in
APP 这些
addition
工
to
具，
that
联邦
background
政府和我们都在不断的改
regular
善
behavior that
这
we need
些
to
工具
maintain during
能
a
够使
pandemic,
得
during
更
a
加给人家提
global
供给
pandemic.
大家提
And
供
that's
更
what
正
we're
确的信
working
息。
toward to make sure that the information
这
that
个
any
我们一
digital
定要
tool
确
is
保
able
这
to
个我们
provide
提供给
is
大家的
providing
信息
people with information that would
这个
change their behavior based on that
一定要
information.
给大家认为，就是我们这个给大家提供的信息是使得你们要改变自己的行为规范，始终提醒大家在这个环境有这个环境 exposure 的这个环境下，这个风险比较高，但所以你一定要注意这个洗手、保持距离，生病了远离人群，戴口罩等等等等。
Well, I think at the moment, I believe a lot of provinces have signed on and are evaluating the app and using the app in their communities. And this notion of does it work depends on what your goals are. And here in British Columbia, our public health teams are reaching people are doing contact tracing, and are able to give the specific information that somebody who has been in contact with COVID-19 needs in order to make a meaningful change in their behavior that reduces the risk to the people they love and to their communities. So at the moment, based on what we see here in British Columbia, the additional information provided by the app wouldn't add to the existing ways and methods of contact tracing. Again, this is right now in BC. We're all continuing to develop tools, to develop methods and ways of reaching people who have COVID-19 or who may have been exposed to COVID-19, to give them the specific and meaningful information that allows them to make the changes in their behavior based on that information.
Thank you. The next question comes from Marcella Bernardo, News 1130.
Thank you both for taking my question. This essentially is for Mr. Dix. You mentioned earlier that it's disgraceful what we saw happen on the Granville Strip in downtown Vancouver. What specifically are you prepared to do to bring these numbers down? Because it seems like a lot of people are ignoring orders. So what next if people are not following the orders that are already in place?
那么他说你们的工作主要是把新增的数字降下来，但是很多人是直接忽略了你们的行为卫生命令啊。他说你的问题很好，谢谢你，也是对我来讲挑战。他说大家看到了这2礼拜数字。他说主要的发生的地点都是私人的聚会，所以这个。所以他说上星期其实我们是修改了法律，我们的这个明确的严格的命令给大家了。
Anxious to follow that. There have been, from time to time, and we've dealt with them. I can recall events that occurred around the third week in March when there appeared to be a lot of people at English Bay as we were dealing with some of the initial really very serious phase of the pandemic at that time. We've seen other situations develop over time that have been concerning to people, and we have to continue to respond to them, I think. But what we have to also focus on, and what we are focused on, is ensuring that workplaces are safe. Ensuring that long-term care is safe and that we can hopefully, by adding staff and supports, allow more visits in long-term care, that we take action where we see transmission occurring, and that is what you see going on. But look, all of us could see what was going on Granville Street. It was on TV, it was on social media, and I can imagine the frustration of the millions of British Columbians who are following the rules of that conduct. And it was a challenging situation for the Vancouver Police Department, and they've spoken about what occurred. But look, we have to, we're facing COVID-19 for a long time to come, for months and months and months and months and months and months and months to come. We're going to be dealing with COVID-19, and for us to do all the things that we want, to have children in school, to have surgeries performed, to have businesses operating, to have some normalcy in these extraordinary times in our lives. We need to follow public health guidance and public health advice. And whether it's workplace BC or whether it's local law enforcement or bylaw officers, there is a role for enforcement, but we also need people, all of us, to be part of this effort. And that has been our goal from the beginning. I think that's one of the things that has been so effective by Dr. Henry and Dr. Gustafson and so many others in public health. And it's what we're going to continue to do. But obviously, that, like all events, are going to be reviewed. And in light of the number of events facing us in the next little while, we're going to have to prepare for that as well.
Thank you, Marcella. And before I ask you for a follow-up, if reporters are asking questions, I request you to please turn off your speaker while asking questions. Please do not be on the speakerphone. Marcella, do you have a follow-up?
I do. Hopefully you can hear me. Let me see if this works. For Dr. Gustafson, is there any way that you can give us any specific events you're linking to recent spikes since Thanksgiving, perhaps any cases that have been linked to polling stations on Election Day?
他说：“你能不能告诉我们一两个案例啊？就是这次这么高的数字，有没有这个一两个活动告诉我们？案例告诉我们。”
No transmission associated with polling stations. Polling stations were one of those situations where voting is a very important thing to do, and there were safety protocols in place. The things that are important to do to us with the right safety protocols can be done, and voting was certainly one of them. The types of places where the types of gatherings that have been associated with transmission tend to be larger gatherings in people's private homes as opposed to in a place such as a restaurant that has a safety protocol or a venue that has a safety protocol. So the types of places where we have transmission are gatherings, what we would call sort of uncontrolled gatherings in someone's home, where there is unnecessary crowding, where there are too many people, and there aren't the safety protocols in place because it's in a person's home and they hadn't thought to have safety protocols in place. That's why one of the reasons that we want to keep, those are the reasons we want to keep numbers small in areas where there's transmission, especially small. And again, the order is the start. And if you are going to have a gathering, if you are going to get together with your friends, do so in a place such as a restaurant or a venue that has developed safety protocols. So many places in British Columbia have learned to operate safely. And so those are the kind of settings. We do see transmission in some workplaces, but again, it tends to be outside of the areas where there's safety protocols. One of the interesting things I'm learning from people doing the contact tracing is while we often associate outbreak with a workplace, again, the transmission often occurs among social networks and among individuals who are getting together with a larger group of people outside the workplace. And so those are the types of places where transmission is being seen, and the safety protocols that exist in workplaces have actually been strengthened. They continue to be strengthened, and so those types of places, transmission is actually quite limited.
Thank you. The next question comes from Moira Witten, the Thai.
卫生措施到位了，就像上次 Bonnie Henry 说过了，卫生措施全部到位了，那么传染的机会就会有限。
And to tailor guidelines to their behaviors and constraints, like people living with roommates or in multi-generational homes who don't really have the luxury of working from home necessarily.
Sorry, can you repeat the question?
Sorry, I think everyone's having a go. How are you planning to further engage youth and to tailor and communicate
他说就是说对这些多家庭、多代家庭。 他们的行为能不能具体的给他们规范？这个很多，比如说祖孙三代啊、四代人他们在一起又要聚集。
I'm glad you're asking about young adults. One of the first steps of engagement was, of course, with our COVID Speak survey. And one of the things that youth and young adults have told us is that they are actually feeling a lot of the consequences of the pandemic. But the pandemic itself, as well as our control measures, in terms of mental health, in terms of ability to make ends meet. So one of our goals through our schools and through our communication plan is to make sure that we engage with young people through their universities, through their workplaces, to really consider what their needs are. What their needs are to gather, what are the safe ways of doing so. So I think it's a really good question and a really good goal. It's something that we are developing a proactive communication strategy to specific communities and specific sectors of our society so that we can look at their needs in order to gather safely, in order to limit their numbers to small numbers and make sure that they meet their needs in terms of work and education. And Minister Dix, I think, has further.
Thank you. Certainly is something that I've been doing over the last number of months is a lot of Zoom calls with young people people and seeking, because I think
他说过去几个月里
communication to
边，他
young
也
people
收
is
到了很
best
多的年轻
often
人的
carried
电
out
话，
by young people.
抱
And
怨
so
他
we've
们
been seeking influencers. We're asking people to be part of health authority campaigns to be influencers of one another. We're obviously reaching out broadly to communities. If you look at Fraser Health, you look at the relative number of people that are hospitalized against
那
the
么
number
大家
of
可以
people
看到，为什么
who
菲沙
have
温森旗
tested
下有
positive
这
for
么多的住
COVID-19.
院
You'll
人
see
数很多的测试阳性
a
案例
number of certainly
就是因为
the
年纪轻
evidence
的
of
人聚集
severe
多
illness isn't there as
这个
much,
都
and
是一
this
些
can
证
have some
据
consequences in the way that
这个
people
就是你们
see
行为上导
the
致的后
pandemic
果
themselves. So
所以大家
we
都
need to
看到了
engage
这
young
个
people
流
that are
行病
affected by
的所
this,
带来的
and
冲
they
击
have paid a significant price.
所以这个
I
是
do
他
want
们
to say
付出
though
的代价
that many of our leaders in this effort have been young people in communities, and I very much appreciate their efforts. And I also want to say how much I appreciate the work done every day by people both at the post-secondary level, but also obviously in
那么
schools,
他也是
both
说，也
elementary
感
and
谢这些
secondary.
中学
In BC,
很
the
多
role
的
that
教
and the
职员
leadership
工以
shown
及
by
同学们
teachers at
付
the
出
classroom
的
level
努
with another
力，包
group
括
of
老
youth,
师
people
们
under 19
等
who
等
are
等等付
obviously
出了
have
艰辛的努
also
力
paid a
为
significant
了这
price
个
in
维
the
持大
pandemic,
家遵守
the
行为规
loss
范
for many of them for months of in-class
这个已经几个
education
月
and all
了
the
这个
consequences that come to that. And I want to express my
所以
appreciation
我也
to the
是
young
代表
people who
我
are
自
showing
己的
leadership
个
out
人
there.
感激
We
之
need more of
情
you,
对这些
and
教职员工
to
也
teachers
是
and
感
others who are
谢
playing
这些年轻
an
的孩子
extraordinary
们。
role. We're grateful for all your efforts.
所以也谢谢你们
Do you have a
能
follow-up,
够遵守
Moira?
我们的行为规范。
I
包括上次 Bonnie Henry 说
obviously
过
we
了，
won't
就是
know
学
the
校
exact impact
这
of
个
last
目前
week's
为止已
social
经
gathering
快2个月
order,
了。
for
那么
another week
这些
or
行为
so.
规范
So
都
I'm
遵
just
守的话
wondering,
呢
like, what， would
这
the
个
next step
学校里边的传播
orders
机会还是很少
or。
那么事实证明，一个半月下来，学校里边传染的案例比较少，只有一个 Corona 宣布爆发，学校关校。
in BC.
So with respect to how we look at our interventions, how we design our interventions, we look at where transmission is occurring. That is our guidance for designing interventions, for delivering interventions.
本来
we look at where
这个
transmission
卫
is
生厅
occurring
长
and
早上
we
给大家打
address
招
the
呼
problem.
有心
And
理
I
准
think
备
that's really
最
important. If
近
you look
这
back
个
at
周末
the
会很高数
interventions,
字，
the
的
guidelines and
确
the
每
orders
天
that have been
300
put in
多
place,
啊
they were in
，352、
response
389、
to ongoing
379，我会
transmission
回给大家重
in
复一
certain
下。
settings, in certain related to certain activities. So the question of what the next guideline would be or what the next order would be really depends on what the transmission is like. And I think that's one of the things that I would like to emphasize. I think it's important for people to know that thought goes into all of this all the time. And one of the things that we do in British Columbia and of course throughout the world is to monitor this epidemic and respond to where the problem actually occurs, where transmission actually occurs. It's a science-based response, so it's not something that we can predict ahead of time, but we certainly are monitoring the data all the time, and we are responding to the data.
We have time for one more question this afternoon, and for everyone listening today, there will be a statement released this afternoon with the latest information on cases, hospitalizations and outbreaks, which you can find at news.gov.bc.ca. For medical guidance on protecting families and communities, and for access to provincial guidance on COVID-19, visit bccdc.ca. For information about provinces' pandemic supports, visit gov.bc.ca/COVID-19. And the last question for this afternoon goes to Joel Ballard, CBC.
Hello, this question is for Minister Dix. Minister, you're already warning British Columbians to prepare for virtual holiday celebrations in November and December. Is there something that can be done now by the government to try and change that trajectory, whether that's a temporary period of increased restrictions or anything like that?
那么现在这样的一个数字，你觉得会不会增加更严格的限制措施？那么他说2位医生都说过了。那么11月份、12月份。那么白天的时间越来越短，那么晚上又是因为回到冬令时了。那么天气越来越坏，那么 所以我们更要清楚我们这个如何安全，比夏天更要清楚如何安全，如何保护自己那么大家看到了万圣节，还有圣节，还有新年、圣诞等等，所以我们都有很多季节要这个节日要过所以私人的聚会我们认为是一个很大的问题，所以亨利医生上个礼拜一颁布了一个新的命令。
With respect to the provincial health order that was put in place last Monday.
上星期一颁布的这个命令。所以希望大家能够遵守这个是时间，正好是遵守这个我们的命令行为规范的。就是说命令再多有什么用呢？的确是大家遵守你不遵守有什么用呢？对吧？希望大家遵守我们行为规范。
Than 6 people outside those living in a home at a gathering, and if you can avoid it, less than that.
那么除了家庭成员外，只能是6个人最多6个人，大家一定要清楚这个。
So you have to use your COVID sense.
那么一般他说家里边800尺900尺的这个地方，你要那么多人，更加拥挤了，更加容易使病毒传播。那么所以我们现在的任务就是要把这个曲线拉平所以我们现在的行为一定导致2个礼拜后的后果。
We can have virtual celebrations
所以今年我们希望大家用一些虚拟的方式来庆祝度过我们的节日，我们必须这么做，只能这么做。
I say that these are the things we have to do now to keep the ones that we love safe and to keep the ones that we don't know safe.
所以这个也是保持我们所爱的人能够让他们安全，只能这个是一个方法。希望他用法语说一遍。好了，那么那么过去的3天不是很多网友一开始就打开看我们的节目。那么周5到周日是352个新增，周6到周日是389个，周日到周一是379个，3天累计1120个。那么从1月份到现在，本省累计了是15501个。那么目前为止是2945个活性案例，就是说记录在案的叫 active case， 其中90个住院比上星期86个增加了4个，但是重症监护呢，上星期4是24个，今天是19个那么过去的3天里边新增了6例死亡，这个也是说明了一下，其中5个是长期护理院的老人。那么另外一个可能也是老人，不一定长期护理院了那么目前为止，全省是6048个是在监视公卫系统的工作人员的监视和这个支持下隔离。这个也就是3天的数字。那么各个省各个卫生局的累计数字呢，今天没报，他报的是新增的，我觉得没有意义，所以就没有记录下来，请原谅。那么如果大家真的要去了解各卫生局下的累计数字的话呢可能还是要到 BC、CDC 各个网站能够找到很多信息。那么今天的这个两个，一个是卫生厅长，一个是 Rick 医生那么他们的现场简报就是到这儿。那么他今天呢，主要是一个呢，就是说上星期一我们的卫生厅卫生官就是 Bonnie Henry 颁布的一个最新的也是最严格的卫生命令，就是家庭里边除了直系亲人以外，所谓的直系亲人不是说平时不住在一起的，这个不算，就是住在一起的以外，外面的只能是6个人来到你家里来这个就是最新的最严格的私人聚会的禁令。那么现在已经1个礼拜执行了第2个礼拜之后就看这个效果如何了。那么无论如何，各个记者问了，就是能不能有更严格的规范，更严格的命令。那么卫生厅长也说了，说实话就是请大家严格遵守我们的 advice， 就是建议，我们的这个卫生规范 guidance也是遵守我们的order， 我们的命令。 也就是这些，只能是呼吁大家严格遵守，自觉遵守了。你说不能举办，我觉得 BC 省做不到啊，这个是国情不一样。好了，各位观众，今天是11月2号，星期一。今天的 BC 省新冠疫情的新闻简报，我们就为大家现场直播到这儿。我们本星期四，下一期我们再会。